clinical language basically escapes the therapy room. And when that happens, it often gets shortened or it gets softened or even memified, for a better word. And then it starts kind of being used as a, let's say, a moral judgment instead of a descriptive tool, which it should be. Normal human discomfort starts being framed as pathology when it shouldn't. Normal human discomfort is normal. Psychology is never one size fits all. Mindfulness is, even if it is amazing for most people, it can genuinely cause more anxiety for others. So it doesn't work for everyone. I've done some research, and it turns out that the term gaslighting comes from somewhere around the 1930s, late 1930s, from a play called Gaslight, which was later adopted into film. And basically, in the story, a husband deliberately manipulates his wife by dimming the gas lights and insisting that she's imagining it. And he does that all to make her doubt her sanity. So then psychology adopted the term, but it didn't adopt the term to mean lying. Gaslighting isn't lying. In psychology, gaslighting is a term adopted to describe a very specific form of psychological abuse, right?
Stories and Stanza is a podcast exploring creativity, resilience, and the transformative power of human stories. Through our 2 series, Between the Lines, with creators, and Fail With Me focusing on wellness and life's challenges, we bring you authentic conversations with inspiring voices from around the world. If you are drawn to meaningful dialogue that both comforts and challenges, follow us on YouTube or any podcast platform. Hello everyone, and welcome to a new episode of Stories and Stanza. Today I am so glad to welcome Sylvia Russen, a psychologist from London, back in the show. We did an episode a couple of months ago about good stress and bad stress, and that got such a wonderful response. We will put the link to the previous episode in the description. And today we are recording a new episode. Hi Sylvia, welcome back to the show.
Hi, and thank you so much for having me back. We had such a lovely conversation last time, so I'm really excited for another one. And I know there's a big time difference between us, but somehow we managed to make it work with all the busy schedule in December. So yeah, I'm really looking forward to this one.
Thank you. I got really good feedback on the first episode. For our listeners, I'd like to give a little bit of summary as to what we are going to talk about. So today's topic is pop psychology versus scientific psychology. So what's true, what's trendy, and how to build real mental health hygiene in daily life. In our information-rich world, it has never been easier to access mental health content, but it's also never been harder to know what's actually reliable. So pop psychology often gives us like some catchy tips, or there can be some viral trends, but actual psychology, scientific psychology, relies on data, peer review, and replicable methods. So our goal is to separate out these two and look at helpful evidence-based practices so that we can tell what are myths and what are oversimplifications. At the same time, I'd like to put on a disclaimer out there for anyone struggling. Please reach out to a qualified professional. And this podcast discussion, it's more educational, and this is not a substitute for professional advice. We are trying to put the right pointers out there so that you can be a better judge of the information you receive. So that's the focus of today's discussion. To get started, my first question to you, Sylvia, is that why does this matter? Why is it so important to understand what is misinformation and what can that lead to, so that we are very clear about the objective as to why we are doing this episode, and then we will go into more details.
Yeah, so thank you for the intro. And I completely agree. There's a lot of misinformation out there, and I think if we can do just our little bit to kind of help try and fight it, then that's great. And this is why we're going to focus on some psychology misinformation that is out there at the minute. Why this is a risk? Because what I've seen in the past few years, especially with social media, is that this thing tends to happen when kind of clinical language basically escapes the therapy room. And when that happens, it often gets shortened or it gets softened or even memified, for a better word. And then it starts kind of being used as a, let's say, a moral judgment instead of a descriptive tool, which it should be. So then once that happens, we tend to run what I've observed myself into about three problems. So there's a risk that people with genuine clinical symptoms stop being taken seriously. There's also a risk, which I've seen a lot more recently, that normal human discomfort starts being framed as pathology when it shouldn't. Normal human discomfort is normal. And three, relationships. And when I say relationships, I mean romantic relationships, I mean family, friends, any type of relationship become battlegrounds of labels instead of actual productive conversations. So this is why I think it's really important that we have a conversation about this. But one thing that I really want to say before we start getting into this is that pop psych this is what I and people generally call pop psychology versus real psychology. Pop psychology didn't really just appear because people are trying to be dramatic or people are trying on purpose to be misinformed. That's not why it appeared. I think it appears because people are finally allowed to talk about mental health more, and that's a good thing. So I really like this shift that we see at the minute for people to talk more about their mental health, whether you see it on TV shows, you see more representations everywhere in general. But this is where we need to be careful. So I think that's why we start seeing a little bit of a dilution between therapy room language and Instagram language or internet language. But I just want to say at the beginning that it didn't appear because people are being dramatic. It's just a shift in the fact that we're a lot more likely to talk about our mental health at the minute.
That is perfect, and I agree with that 100%. There is a shift in the messaging, which is very true. This normalizes the stigma that we have about mental health. The more people talk about it, I believe there would be an increasing attempt and a compassion to understand what someone's suffering might be going through. So that is very important for people to bring it up on social media to talk about this. At the same time, there are things that we need to be very mindful about. One of the key messaging that I am coming across in social media, and I'm sure this is pretty common for anyone else as well, that there are all these advices which are basically oversimplification that does not go into the details. And I see people coming across mental health challenges and explaining that and interpreting that in a way who are not even qualified to talk about this. Now, they can, of course, talk about mental health as a subject, but when they are doing all this preaching, they are all doing all these advices as someone who has seen mental health challenges up close, this does not sit well with me. I have not seen real psychologists go and open up in social media and taking the case book of one of their patients and sharing their problems out with the world. So there is a privacy concern. So if you are coming across messaging like this, there is a high chance that this is done without explicit consent of someone who is suffering. So there is that element. So of course we need to talk about it, but we also need to be respectful of people's privacy, and we should also not put an opinion out there just because social media gives us a platform to do so.
Yeah, I completely agree. And while you were saying this, I actually remembered that I came across a post literally a few days ago that was on Threads, and it was someone, I don't know what qualification this person has or hasn't, but it was around trauma, and there was some advice around trauma, which, as you said, was not personalized, was completely non-evidence based. But the text was something along the lines of, I have spoken in something about like in the past 5 or 7 years or something that I've been doing this. I don't know what this meant. I have spoken to thousands of trauma patients. And I just usually when people read those things, you just glance over it. But this time I didn't. And I asked myself, where did you find in 5 years thousands of trauma patients to speak to? Those are huge numbers, and to be even qualified to treat someone with real trauma, you have to be a clinical psychologist or a psychiatrist or a neuropsychologist. And even then, I don't think they can say that in 5 years they have spoken to thousands of trauma patients. And then, so my questions kind of became, all right, so speaking to thousands of trauma patients, is there like a randomized controlled trial? Is this evidence-based? Is it even a qualitative piece of research? Are there interviews? Is there a thematic analysis? Or is this a longitudinal study? Are there stats behind it? So all of a sudden we see these posts, and if we just stop for a second and ask ourselves, how is it possible for a person to speak to thousands of survivors in the past 5 to 7 years? I thought, no, that's not right. But the problem is that by seeing a post like that on social media, all of a sudden it just kind of gives them credibility. This person spoke to thousands of trauma patients, and a lot of people, unfortunately, don't stop and ask themselves, how is this even possible in 5 years? When do you have the time to do that? That's not real. So all of a sudden, so that for me, the first sentence invalidated everything that was said in that post. And there's so many of those. And it's exactly as you were saying that, we see them, and there's people that are unqualified on social media that are starting to give advice. And that's dangerous, because every single thing, obviously in therapy and in clinical psychology, is best spoke to the individual, to the client, or to the patient. It's not, psychology is never one size fits all. The closest thing that we have to that in psychology is neuroscience, which is completely different discipline. And you could say, like, brains are relatively the same if you look in a normal, healthy population, and maybe you could apply those things more generally. But psychology is not a one size fits all. So seeing this advice that, for example, you're stressed, meditate, or mindfulness. Mindfulness is, even if it is amazing for most people, it can genuinely cause more anxiety for others. So it doesn't work for everyone. Being aware of your own bodily sensations doesn't work for a person who's going, for example, through a panic attack. That's just going to make things much worse. So we need to be really careful about the amount of and the quality of information that we consume on social media.
Spot on. And before we get into more details of today's topic, there is again something else I would like to highlight to our listeners. It's an irony that Sylvia, you and I, we started talking about the podcast and our interest in social media. So we
Yes.
we started talking about this our podcast on Threads a couple of months ago, and
Yeah.
here we are criticizing the same approach. And I want to point out two subtle differences. One of them is I noticed someone shared a post that I am collecting information about childhood trauma and abuse. If you are interested in opening up and sharing your story, this is a form, and this is where you can go and share the details. Now, out of curiosity, since I work in IT, I went into the form and I saw that the form is collecting information. Now, imagine I am coming from a place of trauma and I am a person with that vulnerability. In that case, I wouldn't know. I will go ahead and start sharing those details, and I wouldn't know whether my personal information is protected or not. I called out on that post and I was attacked very heavily. There is this concept of social media bullying, right? If you call someone out, then you get cornered and said, who are you to talk about this? And I said that I am no one. I am just expressing my concern in terms of data privacy and personal details being shared without the proper consent. Like if you put a disclaimer here in the beginning that okay, this form will collect some information by the platform, but you don't know where your information is being shared and how that is going to be used. Now, if someone is in that position, someone is a patient, in many cases they cannot articulate their problem. So it is a high chance that they are being more vulnerable by falling into the cracks of social media.
Yeah, exactly. And I completely agree. There's a big risk here, especially for people that don't know what best practice actually is when conducting psychological research. And I can tell you right now, even in my PhD, I'm about to launch a study, and this is the best practice that you have to have a consent form, you have to have a participant information sheet, you have to participant brief, debrief, and this is just the easy stuff. But then your whole study and your whole research goes to an ethics committee, right? And the ethics committee looks over everything that you plan to do to make sure that the participants are not going to be harmed in any single way. And if they feel any type of discomfort, then they have someone and they are pointed towards the ethics committee or other resources that we have available so that they can use those if anything happens, God forbid. So, and you were saying this about the data being anonymous. That's another thing. Participants have to be informed of every single data that you're going to collect on them, how long you're going to keep it for, how is it going to be stored, when it's going to be deleted, and they need to be able to say that you have, I don't know, 4 weeks, for example, by after the time that you've collected the data to remove all of your information if you don't want to participate in the study, after which the data will be anonymized and you won't be able to be identified anymore. So all of these things have to be told to a participant in advance. And I'm a bit, it's a little bit scary that people would just put a document on social media and collect all of this data. Now, I don't know what was in that document. I don't know if all of this was the data privacy agreement and everything was in there, or if participants generally knew how their data was going to be protected or what's going to happen to their data. I don't know. But if they didn't, then that's not best practice. That's not in line with the ethical guidelines that we have pretty much all over the world. In the Western world anyway.
Absolutely. And I have worked in UK and I work in Australia. Now I understand the GDPR compliance very well. So whenever we are collecting data for our customers, it has to be kept only if customer gives the consent to do that. And that applies more so heavily in the medical field.
Yeah.
For our listeners, another example of pop psychology. I have spoken to a guest who attempted suicide, and he is a chronic patient of depression. He came to the platform and he shared his story, and he explained what depression and mental health challenges look like. He said how it has taken years and years of hard work and electroconvulsive therapy. And in social media today, you see so many posts about depression. That is
Yeah.
not in, we don't know in details whether that falls under the clinical category of depression or someone who is just putting it out there. You don't know.
Yes, exactly. There's something, I think it's now referred to as a TikTok diagnosis, isn't it? Right?
Yes.
That now you feel sad one day and you think that you have depression when no, you don't. That's not what depression is. Or everyone thinks now without having a formal assessment, everyone says I have ADHD or ADD or something like that without a formal diagnosis. And that's not even, I'm not, again, I'm not against people being more informed about mental health. That's a very good thing. But what I'm saying is, if you do suspect that you have ADHD, try to go and get an official diagnosis, because there are medications and there are treatments and there are therapies that can help with that. So what I'm trying to say is, don't use a very serious mental health disorder, I mean, or something that impacts your life, don't use it to explain poor behavior. There's treatment, there's help out there. Don't stay just with yourself thinking, I have ADHD, I can't function properly, this is really affecting my life. There's help out there. And whether there's many platforms online now that are a lot cheaper than I know. And in the UK, at the minute, it's almost impossible to get a GP appointment or to see a psychiatrist or to get an official diagnosis. But there's many other proper good resources out there that can help you manage this. So it's about not using it's about self-diagnosing yourself with all sorts of things that are just, as I said at the beginning, normal human discomfort that is sometimes healthy to experience. It is, again, it's normal, it's part of life, and doesn't diminish and doesn't take away from people that actually suffer from those things. And of course, all of these disorders and these mental disease that we're talking about are on a spectrum. So it doesn't mean that if a person has depression or versus a major depressive episode, they're not going to react the same way. So again, we're going back to the fact that everything is personalized. What works for a person will not work for the next person. Depression is on a spectrum, ADHD is on a spectrum, trauma is on a spectrum. Like, it's not just an umbrella term. It's just very personal to every single person.
Absolutely. One more pointer from my personal experience, and I am a carer for my wife who has certain stages of schizophrenia and OCD. So I've seen this up close and I have seen the struggles, and I'm still dealing with it. So I understand how difficult it is for the person as well as for the medical professionals. Reason being, it's not a linear diagnosis. Like you have a stomach pain, you go and have this medication, or you have fever, go and take a Panadol and it'll be all right. That diagnosis is often a long due process, and you have to go through that to be able to do it accurately. On the flip side, I had to say no to one of my potential guests who reached out and said, you learn about psychology from movies, and the movie references given couldn't be more inaccurate in terms of the subject they portrayed. So they did that. There was some kind of mumbo jumbo which apparently cures bipolar disorder overnight. You
Oh,
being a
wow.
specialist, you would understand that no mental health condition goes away overnight.
I, I mean, can you imagine how great that would be? And if a company or a medical facility ever finds an overnight cure for anything, I mean, the amount of money they would make out of that. And so it's not like they're gatekeeping something like that from us. There is no overnight cure for these things. It's a lot of the times it's a very gradual process where you have to put a lot of work in. But if there would be a cure, then I guarantee you that those companies would want that out there because they would make a fortune. So, yeah.
Well, so thank you. And to our listeners, this was just to give you a context of the areas that we have picked up for our discussion. Sylvia, is there anything you'd like to add to the introduction part, or is there anything that we need to explain to our listeners in terms of what is pop psychology, or have we covered enough, do you reckon?
I think the final thing that I say before we go deeper into some specific terms that I've seen out there used very commonly is that I just want to be again very clear that using a term incorrectly doesn't mean that someone's feelings are invalid. So that it doesn't mean that your feelings are invalid. It just means that the word that you're using might not be doing the job that you think it is. So this is why I kind of thought in this episode that we could cover 4 or 5 of the main things that I see on social media being used recently. Well, not recently, in the last couple of years, in terms of pop psychology. And those are the word gaslighting, triggered, narcissist or narcissism, trauma, and trauma bond. Those were how many? 4, yeah, 5. 5. So 5 terms that I've seen used quite often at the minute as an umbrella term for discomfort for the different situations. And in reality, in psychology, they don't mean what most people think that they mean. So this is what I thought we could discuss.
Wonderful. Thank you for the explanation and picking the topics for today's discussion. I am totally in agreement with the areas that you have picked up. So to get started, let us pick gaslighting for example. And this is such an overused term in social media today, but let us also look at what it clinically means and what are the dangers of using that term without the right context.
Yeah. So again, same as you, I have seen this term used everywhere on TV or in comedy shows. Sentences like, I feel like my eyes are gaslighting me. Yeah, things like that. And we get the intention of it. So I would say that in pop culture, as far as I've seen so far, gaslighting has become some sort of a shorthand for something like someone lied to me, they disagreed with me, they make me feel bad, they won't admit that they're wrong, right? So if all of those were gaslighting, every argument ever would qualify as gaslighting, basically, right? So I've done some research, and it turns out that the term gaslighting comes from somewhere around the 1930s, late 1930s, from a play called Gaslight, which was later adopted into film. And basically, in the story, a husband deliberately manipulates his wife by dimming the gas lights and insisting that she's imagining it. And he does that all to make her doubt her sanity. So then psychology adopted the term, but it didn't adopt the term to mean lying. Gaslighting isn't lying. In psychology, gaslighting is a term adopted to describe a very specific form of psychological abuse, right? So we've got modern clinical definitions of gaslighting as that look at it, and this is really important, a pattern of interpersonal manipulation where someone systematically undermines another person's trust in things like their memories, their perception, their judgment, and a lot of the times, honestly, their own sanity. So often over time, what we see is that there's going to be a power imbalance. And this is what gaslighting actually is. So it has specific features. Again, in clinical psychology, we look at things like repetition. Okay, so gaslighting is not a one-off disagreement. It's something that repeats. There's a persistence again. So the same reality that you think is true, that reality is going to be denied over and over again. There's invalidation of your own perception. So things like that didn't happen, you're remembering it wrong. Then there's undermining your own credibility. Things, it could sound something like you're always confused, you're always emotional, you're always this dramatic. Then it would follow by sometimes by isolation. And it could be a sentence like, no one else would ever agree with you, or ask 100 people outside, they would all say that you're insane. And then what this does is it starts eroding at someone's confidence, right? So the victim in this case starts kind of checking their own memories constantly, and they start doubting their own memories and their own reality. And the difference, right, between pop psychology and real psychology, and this is where the red flag is, gaslighting starts when someone stops saying, I disagree with you, and starts saying something along the lines of, you shouldn't trust yourself. You can't trust your emotions. You shouldn't trust what you're thinking, right? So gaslighting is not two people remembering the same event differently, because in reality, our memory is not a video recording, even though that would be really awesome. So we've got decades of cognitive psychology that shows that our memory is reconstructive and is biased. And this is a big thing also used in forensic psychology. So two people can genuinely remember the same interaction differently without being abusive. So that's not gaslighting. Our memories are biased. And again, we can see the same thing and remember it differently. So when we use the term gaslighting, when we use the term gaslighting in the wrong way, it can cause a lot of harm, because usually one of two things happen. Firstly, people that experience actual coercive psychological abuse will struggle to be believed, right? And secondly, when we accuse everyone of just gaslighting, conflict resolution kind of becomes impossible at that point, as I said, because disagreement basically gets reframed as abuse. Okay, so if someone comes to you and says, you're gaslighting me, when what they mean is you won't take responsibility, then the conversation is effectively over, right? So we need to find better alternatives to use instead of gaslighting. So, this is a thing that you will see in many places across psychology. There's this phrase that we use quite commonly, which is that it's not about the intent, it's about the impact. So it's not about what you intended to do, it's about the impact that it has on another person, right? So you might have the best intent in the world, but you have to pay attention to what the impact your behavior had on the person. And it's shortened as, it's not about intent, it's about impact, right? So what we need to do, and what I like to see in a perfect world, is a shift when we go from, instead of trying to diagnose the intent, you're gaslighting me, we need to try and look at the behavior and the impact. So instead of saying you're gaslighting me, we could say something like, for example, you keep denying things are clearly you keep denying things that I clearly remember, and it's making me doubt myself. So if we take that sentence, in the first part of the sentence, right, is you keep denying things that I remember clearly. That's the behavior. So we spotted the behavior, denying things I remember clearly, and it's making me doubt myself. That's the impact. Instead of saying you're gaslighting me. So even then, just by saying this whole sentence, right, we already, the communication is 1,000 times better, right? It's a different level. And then we can have a more productive communication or even disagreement from there on. So that's the difference between pop psychology and real psychology when it comes to gaslighting.
That is such a very detailed explanation, and I'm sure that someone listening this episode with us, they are able to tell that differences. You have picked some really great use cases, and I totally understand that this is a pattern that we need to see. If this is something one off, that could be something else. It has to be a study. That's where the concepts come in, that this is reputation, there are observations, and then it is recorded and labeled as something in terms of psychology. And we are trying to debunk the myths, so this is so important. So it explains what we chose to speak about, and these examples are so valid, and it gives people a real life correlation. Moving on to the next one is the fact of being triggered. On that,
Yes.
I have something beautifully poetic to share, and that's actually from one of my guests who has written a book called Letters from You to You. So she says that she has written it from a place of higher consciousness, and I cannot remember if I have read something so powerful that has stayed with me. It says that in our lives we come across people who we gel with, who we connect with very easily, who inspire us, become good friends, or we look up to them. Then there are people who worries us, makes us angry or agitated or frustrated. And then there are people who literally have no impacts on our lives. We meet them and they are gone. And she says in this book that think about every person you meet shows you a mirror. And in that mirror, you see reflection of a part in you that the person reminds you of. So the person you are connecting very quickly are reminding you something that you keep inside, and you remember that. So that's how you connect well. So similarly, there are parts in you that you hate or you are uncomfortable with, and the people who remind you of that, you are upset by them, you're angry by them, but you think it is on them. It's actually in you. And similarly, in some cases, there is no reflection at all. So in today's world, we often say that, oh, I'm triggered by my boss, I'm triggered by my friend, I'm triggered by someone who cut me across on the morning drive to work and things like that. But let us unpack that and understand what being triggered clinically means and what are the differences of how we use it. And you can say anything about the book that I shared.
No, I completely get it, and I completely agree. And I think basically what you were saying pretty much boils down to the fact that you can't really control what's happening around you, but you can control your reactions to it. And it's about being aware and doing some introspection as to why certain people make you feel a certain way. So what did that awaken in you, basically, and why? So I think that's a really nice way to put it. But right, clinically, and this is one that I'm very passionate about. Okay, so pop psychology meaning of triggered. It means that you're annoyed, you're uncomfortable, you're offended, or you are what we would call emotionally charged, right? None of those are bad. They're normal emotions, but that's not what the word trigger actually means. So the clinical meaning of trigger in clinical psychology, it's a stimulus, so something that causes a sudden, very powerful increase in symptoms of a mental health condition. So it's something that increases that puts your nervous system on high alert. And it's very common in things like PTSD, complex PTSD, OCD, or panic disorders, right? So it's not just emotional discomfort. This is what I want to say. A real trigger. So if you look actually on the NHS website, it describes PTSD triggers as cues that lead to re-experiencing symptoms like flashbacks or nightmares or intense fears and very strong physiological responsive, right? So it's not, as I said, it's not emotional discomfort. It's in real life, mentally, it causes, as I said, your nervous system goes into fight or flight again, and you can have things like intrusive memories, disassociation is a big one, panic symptoms. And when I say panic symptoms, I mean also physical symptoms like sweating, shaking, racing heart. It's basically emotional flooding, right? And that's with PTSD. Then you can also have real triggers for OCD, right? And those real triggers in things like OCD often activate intrusive thoughts and compulsions, right? Not because the trigger itself is dangerous, but because it activates the disorder's loop, right? So all of these things are, if you look on it, for example, in the UK on the website from Mind, it explains properly what a trigger means. And this is why language really matters here, because when people start saying, I've been triggered because I didn't like that, again, we start blurring the lines between emotional boundaries and psychiatric symptoms. And they both matter, of course, but they're not the same, right? So if everyone is, if everything is triggering, then nothing is. That's the problem. It's like when you board the plane, and if everyone has priority boarding, then no one has priority boarding at the end of the day, right? And the problem is that people with genuine trauma responses will often be dismissed as overreacting because everyone now says, this is triggering me, this is triggering me. So when a person is actually triggered, then you're gonna be told that they're overreacting, that this is insane behavior, this is not normal. Because again, language has become diluted. It's that thing that therapy language has left the therapy room and has come into social media and main media world, and it got diluted, right? So again, what I'd like to see here is more of an accurate vocabulary, I guess. If you're irritated, just say that you're irritated. If you're uncomfortable, just say that you're uncomfortable. If you feel defensive, say that you're defensive. We need to reserve the word trigger for symptom spikes, for things like loss of emotional regulation, and especially for trauma-linked responses to things like PTSD, panic disorder, or OCD. Because I don't want us to reach a point, as I said, where everything is triggering and therefore nothing is triggering, and people are genuinely suffering and they won't get the help that they actually need.
Absolutely. In context of being triggered, in this podcast, I have often talked about emotional intelligence and what are the simple tools that we have in our disposal that we can use when we are feeling something. And I always say that do not see your emotions as good or bad. see your emotions as what they are. Try to understand what you're feeling as opposed to immediately reacting with that. Just process that emotion, label that emotion, understand where it is coming from. You don't have to instantaneously react to it. And I feel that this idea of being triggered, if we focus on that and if we take simple actionable steps around it, we can build our recipe for well-being. And that is where I would love this episode to go as well. We are talking about all these things, but we are also helping people build that awareness in terms of mental health, as to do not call yourself a patient of trauma if you do not understand what it truly means.
And you said something really interesting here that I want to pick up on. You said about when you feel discomfort, it's often possible. If you want, you can sit with that discomfort, and you should learn to feel your emotions and where they come from. You can do a body analysis. Where do you feel that? So, yes, absolutely. However, when someone is really triggered, and this is where the distinction is, they can't really sit with their sensations, right? So one thing, that we were talking about movies earlier and films, one thing that films often do quite well is to show what a PTSD trauma and a PTSD trigger actually looks like, where you see those actors and they're sweaty and they've got those intrusive memories and loud noises. We see this often in veterans, like fireworks and things like that actually trigger them. So this is a really good example that you gave. When people say, oh, I don't know, this behavior or something happened and it triggered me, I need to sit with it and process. No, it didn't trigger. If you're able to sit with it and process it, firstly, very good job, because you're doing the right thing, but it didn't trigger you, because if it would have triggered you, you would not be able to sit there and function properly, right? Your nervous system would be into overdrive, would be into survival mode. So I think that's a really good example of for people to understand the difference between the two.
Exactly. And on that note, I'll also leave some reference here that I've done a few episodes on journaling, and I request my viewers to take a look at them. They are really by professional people who know how to use journaling to their advantage. It's not just some other journal. I have seen the benefits of that from time to time. One of the very good example is when something happens and we don't understand it, if we write it down, it is possible that we should be able to understand what it is. So something happened to me a couple of days ago, and somebody at workplace, I was telling you, right, that we are observing some interesting human behavior in an unstable situation. So somebody said something hurtful to me, and I was upset, and I didn't deny that I was upset, but I wrote it down that this is what was said. I don't know why this is upsetting me. So I wrote that down, and then every time I opened the journal, it made me curious that what was that behavior, what was that coming from. Then I remembered something my dad had said to me when I was younger. That's where this memory was linking to, which is when he said he was upset with me and I was doing everything right. And the person who said this at work is someone senior, so I had that respect for him as a father figure. So I said, oh, okay, so this is something I had unresolved with my dad. I didn't say anything back then. So it's a memory. And that memory is making me feel bad today. It is not trauma. It is not triggering. It is a memory, and it is how we are wired to think. So I'm just giving an example that there are many simple practical tools that we have with us and that we can use in our advantage.
Yeah. And I think you used it completely correctly when you said It's not triggering. What it is emotional discomfort. And that's normal. It's childhood. It's just something that happened in your childhood that affects you into adulthood, which is, again, normal. So it's emotional discomfort, but it's not triggering. But usually, what you'd hear people say, well, this is triggering for me because my father did this when I was a child. No, it's not triggering. It's uncomfortable for you. And that's very normal. And it's very healthy to recognize that and to journal and to do some introspection, but it's not triggering, right?
Absolutely. Let's move on to the next topic for our discussion, which is to understand narcissism, narcissistic personality disorder. That's again something we hear a lot, especially in relationship context. And you have the floor. Let's hear all about this.
So usually we see they're narcissistic, they're a narcissist, and it's usually, nowadays, it usually means things that they're selfish, they're rude, they're arrogant, they're emotionally unavailable, and most of the time it's about your ex, right? So this is how it's described. Your ex is going to be a narcissist. That's how it usually is, right? So with narcissism, what I did before coming onto the podcast, I did something really interesting, right? So I don't know if you've ever seen this, but this here is the DSM-5 manual, right? It's a massive book. It's got almost 1,000 pages. And it's the diagnostic and statistical manual of mental disorders. So in this big book here, you have all of the mental disorders, and you have how to treat them, and you have all of the diagnostics that a person needs to meet in order to have a certain diagnosis. So it goes from everything from eating disorders to mood disorders to personality disorders. So before I came on, I kind of did a deep dive into what here narcissistic personality disorder actually is and what a narcissist actually is, right? So firstly, as we said with everything else, right, narcissism is a spectrum, right? So you can be a very high narcissist and not so much. Interestingly, most people display narcissistic traits sometimes, especially when we're under stress, threat, or a competition. I mean, you see narcissistic traits everywhere in sports, in any type of sports. You see it because they're useful. You need to have them. So again, it's a spectrum, and a lot of us experience some of the traits sometimes. Now, clinical narcissistic personality disorder is an actual diagnosis that you find in the DSM-5, and it's defined by a long-term pervasive pattern that causes impairment across relationships and functioning. It is not something that you do in only one aspect of your life. It is something that affects you across all aspects of your life, right? So according to this massive book that I have right here, right? So if I were to look in here and do a clinical summary, narcissistic personality disorder would be things like grandiosity, need for admiration, impaired empathy. That's a big one. But crucially, what this DSM-5 says is that it must be persistent, it must be across context, and it must cause significant dysfunction, right? So there's an important nuance that people often miss here, that one, someone can be abusive to you without having narcissistic personality disorder, that someone can have narcissistic personality disorder without being deliberately abusive, and that a lot of the times what we tend to see in clinical studies and in therapeutic studies is that many harmful behaviors that sometimes can feel like a person that it comes from narcissistic tendencies actually come from insecurity, right? So when we label someone as a narcissist, firstly, it trivializes a real personality disorder, and there's a big chunk of it about it written in this official book, right? So it trivializes a very real personality disorder, and then it just, again, we turn psychology into character assassination, and that's not what psychology does. That's not what we're trying to do, right? So again, it's about changing the behavior. It's about, if instead of saying that someone is a narcissist, which again, we see my ex used to be a narcissist or something like that, right? You can say things like they lack accountability, they exploit boundaries, they tend to dominate conversations, or they show little empathy. Those are things that we can generally observe, but they don't require a diagnosis, right? And if those things are not affecting a person's life constantly in every single aspect, and they're not persistent across context, and they don't function, then it's not narcissism, because again, it's a very serious personality disorder. Those are observable behaviors that don't require diagnosis, and that we, again, it's a spectrum, and some of us in certain situations will experience, could be classed as narcissistic tendencies, but those are completely normal and persistent. They're not across context. Significant dysfunctions, which are the three main things in the DSM-5 that would qualify you for a narcissistic personality disorder, then it's not narcissism.
That's so important. And again, relating back to our purpose, it's something that I try to echo in every episodes that I do. Is one is curiosity, the second part is compassion, and then the awareness. I think that is so important when we need to understand mental health conditions, because if you are looking at this purely from a psychological point of view, then you do not use the terms to condemn something. you
Yeah.
you study and understand the behavior. Similarly, it's not like this person is toxic, that person is narcissist. We were saying that being triggered, just to understand what you can tell from what are actual triggers as opposed to what are something you can sit with and you can explain. In terms of that relationship side of things, we often miss is that because we look at things from our ego and not from an awareness. So anything
Yeah.
that sits outside our ego, then we can label things incorrectly. But when we are aware of what things really are, then we are at least not labeling things incorrectly. If we are aware, in that case, when we identify certain behavior, we say that this is that behavior, as opposed to saying that just to label something or be hateful about something. So if there is hate, there is probably work to be needed to resolve that hate.
Yeah, I agree. And this is why we were saying earlier, when I gave the example with the, what was it, with triggering, and even with narcissism, it's about the language that we use. It's about identifying the behavior and talking about the impact. And about, we were talking about gaslighting. It's about communicating better, and that comes exactly from what you said, by doing that introspection and by thinking, instead of putting a label, as you said, on something straight away, like that triggered me. It becomes such an umbrella term that I'm slightly afraid that because people use these terms so loosely nowadays, it keeps us from actually thinking about what's happening inside us. And we're going to talk in a minute about trauma, because that's another one that people use very loosely nowadays. And if you just say, I've been triggered this morning by something, you put a label on it and then that's it. You compartmentalize it and you put it somewhere else in your head. But in reality, if you just sit there and you try to find better words to explain what you're actually going through, then that's going to help you process your emotions so much better. And this is where tools like journaling, like you were saying, come into place. It's harder, but it's a lot healthier and it's a lot better for your well-being. Instead of writing, I was triggered, to write, I was upset because this happened, this upset me because blah, blah, blah. It's a whole different level of introspection and metacognition, right? So this is my worry about starting to use these terms loosely. We need to unpack a little bit more when someone says they're a narcissist or I'm traumatized by this. We need to, or toxic, because you give there an example, this person is toxic. We need to start saying, well, wait a second. So what does toxic actually mean to you? What, because what's toxic for me can be toxic for someone else. So let's not use this, let's try to stop using these terms this loosely. That's what I'm trying to say, basically.
Oversimplification. Yeah.
Exactly.
Yeah. And what we generally like misrepresent the triggering and then the trauma and then narcissism in at many cases we can resolve it at our own level if we are well informed, and that's the purpose of today's discussion. Now, yeah, right. So now coming towards the last two topics of today's discussion, trauma and trauma bonding. And I already shared what I often see is that people are referring to memories as trauma. In some cases, like we are referring to sadness as depression. But sadness is when you know why you are sad. Depression, you don't. So it's that.
I mean, with that, you can know why you're depressed, and a lot of times depression has a very clear cause, but sadness is a normal emotion. It's a normal thing that people should feel. If you're sad about something, it means that you are emotionally regulated, that it's one of those things that narcissists, for example, don't really feel very much, not always. So it's, yeah, so depression is, there's a few debates now. There's new theories about what actually happens in the brain when we're depressed, and it's actually very different than just being sad. But yes, moving on to trauma and trauma bonding. Okay, this is another one that we see very popular nowadays, and what it tends to mean in pop psychology is anything that hurts you or upsets you. This is what, this is, it was, my flight was late, I had to be stuck in the airport for 3 hours, it was traumatic. No. But again, the pain is real, right? Okay, so no one is debating that, but trauma has a very specific meaning, right? So clinical definition of trauma is something along the lines of an event or a series of events that are experienced physiologically, physically or emotionally, and those events are harmful or life-threatening and have lasting adverse effects on functioning and well-being. And that's the key in the definition: lasting adverse effects. So the effects last for a very long time. And that's the last part that people usually skip when they talk about trauma. So something upsetting happens to them, something bad happens to them, but we don't take that second part of the definition into context, which is the most important, lasting adverse effects, right? Does it have a lasting impact on you? No, then you're not using it properly, right? So trauma, a lot of the times, to make it easier to understand, is about the aftermath, not the severity, right? Of the aftermath of a certain event. So it's not defined by how bad it looked to others or whether someone else had it worse. That's not how trauma is defined. It's defined by how overwhelmed you were at the time and ongoing effects afterwards when we talk about trauma. And we're looking at ongoing effects in clinical psychology. We're looking at things like hypervigilance or avoidance. When there's a genuine trauma, you avoid the real triggers, right? For many years after or a long period of time. They can be emotional numbing because that, again, that's a protective mechanism. We look at sleep disturbances. We look at difficulty trusting. We look at basically nervous system dysregulation, right? So this is trauma in a clinical context. Now it becomes a problem when everything becomes a trauma again. So what I was saying is like this umbrella term, and that we use very loosely, that everything becomes traumatic, because then I feel like trauma becomes synonymous with hardship, which is a normal part of life, right? And we all go through hard periods in our life, but as long as it doesn't have a negative, long-lasting effect, then we might want to requalify it as emotional hardship or physical hardship, whatever, instead of traumatic. Because again, when we start calling everything traumatic, then people will start to minimize severe trauma. And then we have another thing that happens is that resilience, which is hard to build, but it's very important that we do so. Resilience becomes pathologized, right? And recovery a lot of the time gets misunderstood, right? So how you would recover from an actual trauma is very different than how you recover from hardship. And resilience that is built in the face of hardship is very different than resilience that is built in the face of trauma, right? So again, I want to say here that some experiences are painful, they are unfair, they have a deep impact on us, but they can do so without being traumatic in a clinical sense, right? And that doesn't make them trivial in any shape or form. It's just about not rushing the label, right? So we need to ask ourselves, what changed afterwards, after the event? Ask ourselves what still shows up inside and what support do we need, right? Because not everything in reality needs a diagnosis to deserve care. So we don't need to have a diagnosis of trauma to deserve support. But at the same time, we shouldn't also take away from the people that suffer from genuine trauma. And then after this is in a way related, but also not related with trauma bonding, which I'm going to go over in a minute, where people will understand that, again, I think trauma bonding will be the most surprising in our conversation, because in reality, it means something completely different than pop psychology. Whereas until now, we've seen some aspects of the real clinical term that falls into pop psychology, whereas trauma bonding is actually completely different. Does that make sense?
No, it definitely does. And I totally agree that with these explanations, we are not downplaying something we feel bad about. So we are 100% recognizing that And we are also trying to say that if we understand what is trauma and what is not, probably we would be in a better position to take care of our well-being.
Exactly. So this is why I said that it's really important to understand what shows up inside. And this is where, as you were saying, language is extremely important, the language that we use, because then if we go into the whole neuroscience of it and neuroplasticity and things like that, your brain becomes better at what you repeat. So the more resilience, the more we ask ourselves what we need, and the more we sit with the hardship, the more journaling, the more introspection we do, then that will physically rewire your brain into having better reactions, better resilience, better understanding of yourself in times of hardship, not trauma, basically.
Yes, and hardship is very natural. It is
Yes,
bound to happen, whether we like it or not.
exactly. Whereas trauma isn't. Trauma is something that you want to avoid. You will, as a person living in today's day and age, you will experience hardships, right? You can say that. I think like 99.5% of us will, unless they're in the 0.5 extraordinarily lucky people, but not 99.5 of us will experience trauma. So that's a difference, right? And this is why language is so important, where instead of throwing the terms out there. Should I go into trauma bonding?
Yes,
now?
absolutely. Thank you for explaining the trauma aspects. I think it has to be really well understood. And at the same time, as we are encouraging people, is to take care of themselves, build that mental wellness into their routine. It's not something people can do one day and then they forget about it. I'll share something very interesting just to break the discussion, just to make sure that we bring in some sort of anecdotes into the conversation. So because I talk a lot about EQ and journaling, creativity, all of that, anger management in the podcast, recently I was in a social gathering and then someone asked that, oh, I listened to your podcast and you speak well on anger management and things. My husband is very angry all the time. Can you tell him about it? And I said, look, I'm not a qualified person. I do a podcast for information. I'm not offering any kind of guidance. I can share my story if that helps you, but I suggest that you do your own work. But she kind of insisted, and she took me to her husband and said that please listen to this man for anger management. And I shared my own story, and I shared that I had a period of completely burning out, and then that had a very negative impact on my physicality. Okay.
Yeah.
And when I started building into my well-being routine, taking care of my body, taking care of healthy eating, good amount of resting and recharge, and taking care of mental well-being and things like that, I gradually understood where I was keeping my anger. It's not a trauma per se. There were memories that I was holding on to, and when I started taking care of myself, I understood what they were, and I was able to rewire that stories in my mind. The said gentleman got very upset, and he started some kind of verbal abuse. You don't know shit. And I said, what I did, it's not a cookie cutter thing that it is going to work for you. What you need to understand that your well-being is like cleaning your house. If you think your house is not dirty, then you will not clean it. If you think it needs cleanup, then you will put your work on it. So what I went through was an uncomfortable process, and I recognized that facing our feelings can be uncomfortable. All I am saying is you face that discomfort if you really want to move past it, instead of labeling it or putting it in a box, just to
Yeah.
understand what they are. And in many cases, you should be able to find that answer yourself. If not, of course, please seek help. But there are certain things you can do at your own level, and that awareness is what I am building. I'm not selling anything, I am not promoting anything, I am
Yeah.
creating that wealth of knowledge with people who have joined me. So, really linking back that to trauma and trauma bonding. All I'm saying is that there is discomfort in the real world, and the
Yeah.
better we are in facing it, better we
Yeah.
can take care of ourselves.
Exactly. And I actually really like now this anecdote that you use with cleaning your house, because you can add on to that the fact that it is indeed like cleaning your house, but it's also like the difference between cleaning your house properly or just putting on some candles that smell nice or spraying some Febreze and without opening the windows all the time. So someone comes into your house and you feel that the air is stale, that there's no fresh air in there, that it hasn't been clean, and you just stick on some candles to make it look nice. In reality, you haven't done the work, right? So there's a difference. It feels different when you're in a
Yes.
house where you put in the work and you cleaned it properly and you destroyed the bacteria and you vacuumed and you dusted and wash your dishes and everything, and you do your laundry and stuff, and then you can put the nice candles and it smells nice, versus just popping on the candles. So this is actually quite a nice analogy that you may hear about. It almost works like people don't do the work, it's just distraction, for example. So, and we see this a lot with, unfortunately, when people get addicted to drugs.
Yeah.
So the first, it's a lot about numbing
Yeah.
what's inside, distraction, not feeling it,
Yeah.
right? Whereas it's a lot harder to actually clean your house, as
Yes,
you
I
said.
was just trying to say that it's not like, oh, you take a pill and tomorrow you're not angry. You have to
Yeah,
do the
yeah,
work to understand what is troubling you, and it works like an onion. Today you may not be angry, but tomorrow you might be angry on some other thing. So you need to
yeah.
keep your mind, and it's like it's a routine. It's not like it's something you do today and then you can forget about it. That's why I say that cleaning your house example.
Yeah. It's a very good analogy, but it's about cleaning your house properly, like not pretending,
Yeah.
not just the surface level so that it smells good when someone comes.
Absolutely,
comes over you.
absolutely. No, very well said. I'll keep that in
It's
mind.
a very good analogy. It's a very good analogy.
Thank you so much. Let's move on to trauma
Right.
bonding. Yeah.
Trauma bonding. Yeah. So trauma bonding is something that we see online a lot, and it means things like I'm with a friend of mine, and as I said, I don't know why today I have the airports in mind. I don't know what's happening, to be honest, but all of my examples are at airports. But it's like, again, our flight is delayed. We're stuck in the airport. We had to spend the night in the airport. Oh my God. We trauma bonded. Or trauma bonding after a relationship. We went through hard things together. And therefore, because we went through hard things together, I can't stop thinking about them. Or even when this is one of my personal anecdotes. Earlier this year, a friend of mine celebrated her birthday, and we went to an amusement park, and we were riding roller coasters. And she said to me, "We're gonna trauma bond through the pain of riding roller coasters, being in the emotions while we rode the roller coasters." When in reality, we both love roller coasters, but it was just like, we're gonna make those memories while we trauma bond with the roller coasters. And it's almost used romantically, even if it's just a friendship. It's like suffering together automatically creates a deep bond. But in reality, that is not at all what trauma bonding actually means in psychology. So the boring stuff that it comes from a psychologist called Patrick Carnes, and it comes from the context of abusive relationship, but particularly where there is intermittent reinforcement. So there's cycles of harm followed by relief, affection, or repair. So in psychology, in clinical psychology, trauma bonding refers to a very strong attachment that forms between a victim and an abuser, driven by cycles of abuse and kindness, fear and relief, power imbalances, and unpredictability. So it's not trauma bonding in reality in psychology is not at all about sharing hardship, right? It's about conditioning. So those are two very different processes. So trauma bond is about the fact that an attachment is formed through repeated betrayal combined with intermittent reward, which basically strengthens the emotional dependence rather than weakening it. And it's a very easy, when we look at trauma bonding in psychology, and in the DSM-5, actually, the diagnosis, it follows a very specific pattern. So it's almost like you have arrows. It's like a cycle, and it goes from something called idealization at the top. Then you have devaluation. Then you have reconciliation, and then you have repeat. So a trauma bond is this cycle of 4 patterns that have to happen in order to create a real trauma bond. So someone, for example, there's a period of emotional pain followed by intense relief. Then there's apologies, affection, or closeness after harm being caused. And then basically what happens is that the victim is conditioned to learn that enduring pain leads to connection. And it becomes a conditioning rather than something harmful that you share with someone else, right? So in learning theories in psychology, we call this intermittent reinforcement. And it's from behavioral psychology. And it's actually, a lot of studies actually show that it's one of the strongest way to condition attachment, because your brain actually starts to associate relief with love, and they're very different. You start associating intensity with connection, again, very different. Or you start associating survival with attachment. And when I say associating, I mean you become conditioned to associate them, right? So conditioning, we all know about Pavlov's dog, like ringing the bell, dog salivates, food, right? So trauma bond isn't romance, isn't a deeper friendship. It's a process that is very much neurobiological conditioning after under stress, and it's extremely powerful because trauma bond often feels, for real victims, it feels intense, it's obsessive, it's very hard to break, it can be confusing, and it's emotionally addictive, right? And this is why the condition is very strong. And this is where pop psychology completely misses the point with trauma bond. People in trauma bonds don't stay with that person because they're weak or they're naive or they're being dramatic. They stay because literally their nervous system has learned that safety is unpredictable, right? And that relief feels like love. And that's completely different than what trauma bond means in psychology, right? And this is supported, the real meaning of trauma bond is supported by so much, tons of research that shows that chronic stress and this kind of threat of reinforcement, this hot cold type of dynamic in a relationship can very seriously dysregulate attachment system and emotional dysregulation, right? Emotional regulation, sorry. So trauma bond is not bonding over shared hardship or shared adversity. It's not about when we support each other through grief and illness. It's not about missing your ex or feeling attached to someone after a breakup. And it's not about missing someone who, I don't know, treated you poorly or something like that. Two people going through something hard together is not trauma bonding. Absolutely not. A trauma bond requires harm, it requires imbalance, it requires repetition, and it requires an emotional dependence that reinforces itself by relief. Okay. And without those elements, without harm, imbalance, repetition, and this emotional dependence, that's not a trauma bond. The trauma bond does not apply, right? And this is and this is why I wanted to finish with the trauma bond, because this term is so overused, the same as triggered, to be honest. And this is a problem because, as I said, some of the other terms that we've discussed today have some similarities from psychology, but trauma bond is completely different. And it does not mean what people think it means. And that's why it's a problem, because calling every intense or unhealthy relationship a trauma bond, firstly, it pathologizes normal attachment and grief, right? Because breakups hurt. That's completely normal. Missing someone doesn't automatically mean a pathology, right? And it obscures real abuse dynamics. Trauma bonding is a really serious mechanism that keeps people and their nervous system stuck in very dangerous relationships. And when it becomes a shorthand for toxic X, then again the meaning gets completely diluted. And it also creates shame, right? People start thinking, if I'm trauma bonded, something is wrong with me. When in reality, trauma bonding is really just an adaptive response to repeated threat and relief, threat and relief, threat and relief. This is how it goes. It is absolutely not a personality flaw whatsoever. It's a brain conditioning situation. So we need to ask ourselves again, was there, before jumping to a label of trauma bond, which doesn't mean what you think it means at all, we need to ask ourselves, was there a repeated cycle of harm and repair? Was affection used to offset fear or pain? Did I feel calmer only when they were pleased with me? Or did leaving them feel physically distressing, not just emotionally sad? So those questions can get a person a lot closer to the truth than misusing the term alone, right? And if the answer is no to any of those questions, then if the relationship was simply intense, painful, or badly matched, then the terms like attachment or grief or emotional dependency may be a lot more accurate here, but not trauma bond. That's not what it means.
Thank you for sharing that. And I'm sure that this brings our discussion to a perfect end, that we explore different aspects of it. And when you were explaining this, I kind of reminded something I read very recently, that we use the word toxic masculinity to represent misogyny.
Yeah.
But the origin of the term was the traits that were harmful to men's mental health. And with social media and pop psychology, it has completely been misunderstood and being used in context whether people are not well read about the true reference behind it.
Yeah, exactly.
and it has completely changed the direction, and then you come across the terms more often. I guess all we are saying is that we are responsible for the words we use. We should use a better language to represent, and at the same time take care of ourselves and get help when we need to
And
understand ourselves better.
I think it's really important that, as you were saying at the beginning, and now we're going kind of full circle, to listen to actual experts if you're going to listen to someone. And again, I'm very happy that people are talking a lot more about their mental health and that there's a lot more resources. But all I'm saying is, people should do a little bit more of their own research. Just don't take things that you see at face value. And this was a perfect example, I think, with trauma bonding. It does not mean in reality what we all think it means. And we have to be careful who we follow on social media, what kind of content we consume, do our own due diligence, and understand again that one size doesn't fit all, and we have to find what works for us. And we need to get the help that works for us. And this, again, just be careful. I think we need to be careful of the type of media that we consume, basically.
Absolutely. We discussed a lot of things, and thank you so much for your time this morning.
This will be useful. And thank you so much for another awesome conversation.
I think we did wonderful. Anyone who is listening to our conversation, please follow Stories and Stanza for more meaningful and insightful discussions, so that I can connect with the experts from all over the world, bring you that authenticity, that real human experience and knowledge, so that we all can live a better life. Thank you once again, Sylvia.
Thank you.